Hello, I'm Laurel Federbush. We hear a lot about the overuse of antibiotics and the associated dangers of that, but today I'm going to talk about the underprescription of antibiotics, which is in itself a danger. I even wrote a book about it called The Underprescription of Antibiotics for the Elderly. There are new directives being implemented by the Center for Disease Control, or CDC. Since these directives come from on high, they get implemented everywhere. So it doesn't do much good trying to look for a different doctor, a different hospital, or a different long-term care facility. In order to crack down on what the CDC considers overuse of antibiotics, they've spelled out a very narrow window of situations where antibiotics may be prescribed. Well, good, you may be saying, and there certainly are serious dangers when antibiotics are prescribed in some cases. But what do these directives actually mean for you and your loved ones? I'm going to talk a bit about the situation I'm dealing with, which is how I got into this whole subject, not being a healthcare professional myself. I have an elderly relative who suffers from recurring urinary tract infections and colonization, which is when a bacteria that normally resides in your body may start causing problems. Also, recurring yeast infections. In the past few months, she began having a delirium as a symptom of these episodes. Delirium is a bit like dementia, but it has a very clear starting and end point and is related to infections or other causes. Each time she was treated with antibiotics, the delirium immediately went away, along with the infection. Recently, the healthcare professionals en masse have declined to treat her with antibiotics. This leaves her in a continued state of delirium. A person with delirium is totally debilitated, unable to live any kind of a normal life. The medical professionals who condemn someone to this state by denying treatment have no compunction about essentially taking away a person's life. After all, old people are like that, delirious, confused. It's just the way they are. You can expect to hear plenty of sweeping generalizations about old people from the healthcare providers or healthcare deniers, probably a more accurate term. Old people this, old people that. Doesn't matter to them whether or not the stereotype they're spouting has ever been true of the specific elderly person in question, and they make no attempt to find out. You as a patient advocate can expect plenty of condescending lectures about how, as people get older, their health naturally declines. Really, no kidding. A person with delirium is increasingly difficult for caregivers. Someone with delirium requires constant care and supervision. If you as a family member can't drop everything to become a caregiver, you have to pay thousands of dollars a month to get that kind of help for a loved one. Medicaid kicks in only after nearly all of the person's assets and possessions have been relinquished. The medical people who condemn someone to this state by refusing treatment have no concern for what it means that they're robbing a person's life. They don't factor in whether or not a family is able to provide that kind of care. The medical writings that are guiding this talk about infections with no symptoms as not requiring treatment with antibiotics. How can an infection have no symptoms, you may ask? It can't. But these medical professionals will claim that it can by attributing any symptoms that occur to other causes. For example, delirium, they will tell you, can have many causes totally unrelated to infection. I would urge people not to believe much of the information being put forward by medical people at this time about delirium, because it's entirely self-serving, designed to relieve them of their responsibility to treat an infection or find the cause. In addition, what it takes for something to qualify as an infection is made unnecessarily high, so that it needs to be virtually life-threatening. A run-of-the-mill infection is no longer an infection. So people who could be treated sooner are left to wither away until the situation is dire enough for doctors to swoop in with an antibiotic cure, which at that point might be too late. Older people deserve better than this. Concern about the overuse of antibiotics should not be a reason to do harm to seniors and their families. Thank you.